What's up, Fit Fam? If you don't know me yet, I'd like to welcome you to the group. Hello, I'm Coach FitPro J, your diet-free fat loss specialist. I've been there, done that, and I'll help others do the same. Those are my before and after pictures up there in the group's cover photo. I help successful busy people turn their mom and dad bods into oh my God bods without overwhelm by keeping it simple, keeping it moving, and keeping it real. Thanks for joining us tonight, or I should say on the replay. Before we get into tonight's workshop, I wanted to thank you all for the positive feedback on the last event with Rachel. We talked about skincare from the inside out. Next time Rachel's on, we'll be discussing the brain-skin connection. That one should be interesting. We'll do that in about a month. Okay, on to tonight's main event. Tonight, we have with us our group expert, performance physical therapist, and certified strength and conditioning coach. Did I miss anything?
That's the most important stuff for tonight. So yeah.
All right, that's Zach Wagner of Wagner PT and Performance. He's over in Lakeville, Massachusetts. So you got to go check him out over on Bedford Street. I'll get you his information when we're done here. But Zach is going to conduct our group's first virtual performance physical therapy workshop. This workshop will be all about the topic that you picked in the poll, lower back pain. Zach, would you mind introducing yourself to all of the new group members and start the workshop?
Absolutely, yeah. So Jason, thanks for having me on again. Like I said, I'm excited to do some of these virtually and probably doing quite a few more of these in the future. Like as Jason said, my name's Zach Wagner. I'm a physical therapist, strength coach, and owner of Wagner PT and Performance, which is like he said down in Lakeville. And the people that we work with are largely people like yourselves in this group, people who are busy parents, professionals, business owners, people who really need to get the best out of their physical therapy, get the most out of it because they don't have a ton of time. They can't waste their time. They got to make sure they get the results that they need. So we function in what's called a performance physical therapy model, which means it's always one-on-one, always working with a doctor of physical therapy in a gym setting. So, we really get down to business every time. So looking forward to helping you guys stay healthy and or get healthy if you need our help with that to make sure you can make the most of Jason's programming and some of the stuff that we're going to work with you on within his program. So it should be good.
Excellent. Thanks, Zach.
Cool. So what we're going to cover today, like I said, we put a poll up to talk about what you guys thought was going to be most useful. And low back pain, I was not surprised. We were talking about this before we started. It is the most common thing that we see with the our patient population that's in your age range. We work with a lot of youth athletes as well. We do see it with them, but we all have probably been there before. There's probably a very small percentage of people who, I don't know if anybody can say once they get past a certain age that they have never experienced low back pain. It's a very large percentage of people. But what we want to talk about is how we can take some basic steps today that are going to be high leverage for you. Things you can do that aren't going to take a ton of time and effort, but are going to keep you moving and help you understand how to keep your back healthy and then how to, pull yourself out of the hole if you get yourself into a bad situation or something along those lines. Okay. So
I love it, Zach. Keep it moving, right, Zach?
That's right. Absolutely. I mean, honestly, that's probably the biggest thing and the simplest, but the highest leverage advice we can give in cases like this a lot of times is the vast majority of the time, the best thing you can do is to keep moving, is to not stop. Obviously, you have to modify. And that's where somebody like myself comes in. If you're dealing with something that's more acute, higher levels of pain, things you're not sure what's going on, that's what we specialize in, is helping people make sure they can continue to move in the way that they can, because we just know that that keeps pain from getting worse and it makes it, get better a lot faster as well. So, kind of going off of that a little bit, obviously we're not ignoring red flags. And by that, I mean, everybody understands, I think for the most part, when back pain is severe enough that you need to get it looked at right now. And that's not what we're going to talk about today, obviously, but if we're dealing with things like if you had an accident, a fall, a car accident, and there's a lot of really severe pain, you have nerve symptoms, you have numbness, you have tingling that came on quickly, that kind of stuff, you don't mess with that, right? What we're talking about today is your low back tweak, your little discomfort and some soreness, or things that's a little bit more chronic that kind of comes and goes, because that's the thing we're dealing with the most often. Jason and I were just talking before we started this. We both were dealing with that kind of stuff at some point, being highly active people. And what I want people to understand is that just because you're going to deal with, having some orthopedic pains here and there from being super active, that shouldn't deter you from being active, because that's something we can deal with, right? You can deal with a little bit of discomfort. You can deal with a little bit of pain, some of that kind of stuff. Like, that's what we do. What we're getting you healthy and active for is to avoid being overweight, avoid having diabetes, avoid having high blood pressure, heart disease, all these other things that are a whole heck of a lot harder to deal with. I always say, I'll take a little bit of back pain, shoulder pain, knee pain, mild stuff that we can deal with over that stuff every day of the week and twice on Sundays, right? So
Yeah, sign me up on that. I'd rather keep it moving and have a little bit of pain than to avoid a lot more host of issues and problems
right,
along with that pain and worse pain probably.
right, absolutely. And then when you do it the right way, it's discomfort, but it's discomfort you choose. It's stress, it's discomfort that is kind of constructive for you. So that's what we're going to try to help you do hopefully today. So just why low back pain tends to happen for a lot of people, honestly, is that what we see is that people's sort of baseline level of activity isn't quite where we want it to be. Their activity levels will fluctuate. Around here, it's because of doing different tasks, or having to shovel snow in the winter, or yard work at this time of year, like all this kind of stuff. So what we're trying to do is really prepare your body for what it needs to do on a day-to-day basis. So your body will adapt to whatever demand is placed on it, right? If your activity levels do this all the time or all over the map, your body's not going to really know what to do. And then when you do something that is heavier, more stressful for your lower back, specifically in this case, sometimes that leads to some pain, some discomfort. So one thing I want you to understand is that that's not, in fact, the majority of the time, that's not something that's really, really serious. It's just you overworked an area. What we always say is you did too much too soon after doing too little for too long. Okay. So how do we make sure that we don't get into the too much too soon situations by doing more on a consistent basis? And that's a fitness program, like we're going to talk about, in upcoming weeks and months with you. So that's probably the number one thing, right?
And I think, Zach, too, to add, I think a lot of people's issue is that they don't know what movement to do, or they're unaware of what that pain is, or when to stop, or what is too much, that sort of thing. And they just get paralysis analysis, if you will, and then they don't move at all, and then it exacerbates the issue.
Right. Absolutely. Yeah. And that's where I think, you're not supposed to be an expert. I talk about this all the time. People in this group, you're not supposed to be a movement expert. You're not supposed to be a pain physical therapy expert. That's what we're for. Right. So we're here to give you some basic stuff and the things that you can do kind of across the board to kind of make yourself healthier. But I just can't reiterate more. When you need help with some of the stuff, that's what we're here for. So ask the questions, come, help. We're here to help. So
It doesn't hurt to ask. It hurts
right.
not to. It can't hurt not to ask.
Yeah, right. Absolutely. Yeah. So, I always talk about, I'm not a mechanical guy from like a car perspective. So I take my car to my mechanic. I let them do that because that's what they are good at. I take my taxes to my accountant, and because that's what they're good at. And,
You stay in your lane.
I take my contracts and my wills and stuff to my lawyer because I don't know what I'm doing when it comes to that. So, you're not supposed to know everything about everything. So, use the resources you've got, right?
Awesome.
Cool. And one little analogy I think I find, for some reason, the low back, a lot of times people get a little bit more afraid. They get a little bit more freaked out about low back pain as opposed to pain in any other kind of part of their body. Like right around this time, I think a lot of us are probably doing a lot of raking, clearing leaves, all that kind of stuff. So, if you hadn't done that forever, and then you do a bunch of that and your shoulder's kind of sore, but say the next day you wake up and it's fine again, you're probably not really worried about that. You're like, oh, I overworked it a little bit, it'll be fine, right? But sometimes we see when people have low back pain from a very similar sort of thing, they kind of freak out a little bit, even if it goes away and even if it's really mild. But just want you to understand, the back is just a series of joints like a lot of other parts in your body. It's still bones and ligaments, muscles, tendons. It will respond to stress positively and negatively. So you train it like any other part of your body. So that's, a foundational thing for today as we move into some examples of exercises and all that kind of stuff.
Oh, no, that makes
Cool.
complete sense. Excellent.
Yeah. So just don't forget, it's still part of your body that you can treat it, like anything else. It'll get stronger if you do things the right way, All right.
Yes. Yeah, the worst thing is to just do nothing.
That's right. And I've already said it like 3 or 4 times, but it's an important one. So, So the three kind of main areas, again, we just talked about keep moving, keep doing what you can, move consistently, even if you're having some discomfort within reason, obviously. And then the other things we're going to talk about are how do we improve your mobility and then the mechanics so that your low back, your hips are moving well, core is strong, all that kind of stuff. And then also just in general, how are we making you stronger and more capable? In this case, the low back, the hips specifically, but also just in general, the more active, the more strength, capacity, resilience you have, whatever word you want to use, that's what's going to help you avoid back pain, but then also bounce back from it a lot faster if you do happen to develop some. So that's kind of overarching structures there. That kind of makes sense.
Yeah, a bit of preventative maintenance, if you will.
That's right. We all know we gotta be active and for lots of reasons, for fat loss, for weight, but also just for orthopedic health, right? Your body's meant to move. If you do nothing, it's not going to be happy with that. If you run yourself into the ground every other day, it's not going to be happy with that either. So you got to find that kind of happy medium. Cool. So what I'm going to do is share a few exercises in some categories and some basic stuff that I will share afterwards as well that you can start to look at to get your back moving, get your hips moving, and start to work on some strengths. So you have some ideas of where to start with some of this. So Jason, if you don't mind, I'm just going to share my screen so I can pop up a couple of things here.
Sure, go right ahead.
All right, so what I'm going to do, I'm just going on to everything good there. You see my screen there, Jason?
Yep, awesome, perfect.
Perfect. So this is my YouTube channel. I basically use it. It's a repository mostly for exercises for all of my patients. But what I'm starting to do is put together more playlists, more things for people to reference if they're dealing with specific issues. And I have a few things for you guys in terms of low back pain. What I want to talk about first is just what we would term like motor control, meaning can you move your spine? Can you control your spine? Okay. So there's a video we like to use if anybody's familiar with yoga, just called the cat cow. We're just moving the spine through good movement, especially with this version, we're trying to control it. So if I play this video here, what we're seeing here is we are just moving the spine. This would be called flexion. So a little bit of a rounding position here, tucking the head, tucking the butt here. And then with this version, what I'm trying to do is move real slowly throughout the whole spine and just trying to control everything as we move here. So this is a great thing to do as a warm-up before you're going to run, before you're going to lift, or if you're just feeling stiff, or if you're sitting down a bunch, or you're dealing with a little bit of soreness in your back. This is something that can be really helpful. So this is what we would call a cat-cow. You can also do this a little bit faster, but like I said, if anybody has done yoga before, I'm sure they are familiar with this movement. This is a classic kind of a yoga pose. Cool.
Oh, that's got to be great for the back.
Oh yeah, absolutely. It's a big one. It's just, and it's simple, right? It's like one of the things, if your back is sore, move it, Oh, sorry. Okay. So next one I want to talk about. So that's kind of our motor control. Just again, real basic. Can you move the spine? Can you control the spine? And it doesn't have to be more complicated than that. Obviously, if you came in for treatment, there'd be more to it than that. But that's a great place to start. Just lets you explore how things feel. Another piece I want to get into is hip extension. So by that, I'm going to play this video and pause it at a certain point. You can see what I'm talking about here. Meaning, can you extend your leg behind your body? Okay. So this is what we call a couch stretch. I'm going to fast forward it a little bit so you can get into a more full position here. So this position here is what we would call like a full couch stretch. And we call it a couch stretch because we originally thought of it as standing in front of the couch and sticking your back leg up against the back of the couch, right? So
there you go.
That's what I call it. That easy to remember, but this is obviously on the wall here. So this hip that's down on this video, my left hip here, is in hip extension. So if I was to draw a straight line from kind of ear down through shoulder and down here, that's like what we would call a neutral hip position, okay? The right hip is in hip flexion, meaning it's in front of me, and then the left hip is in hip extension, all right? So hip extension is very important because what it does allows you to use your glutes, your gluteus maximus, right? The money shot muscle, right?
Yeah, and that's a lot of people don't usually activate that when they work out.
Right, absolutely. And it's just one of the things we find is when people have low back pain, a lot of times what is happening is their hip is stiff. They're not able to access good range of motion there. So these big, powerful muscles around their hips aren't able to do their job to support their low back, share the stress, share the load, and some of that kind of stuff.
So weak glutes, sore back, potentially.
A lot of times, yeah, and what we see a lot of times is that this compounds when we do a lot of things like sitting in the car, driving, sitting at a desk, all these kinds of things, because your hip is in this position, flexed in front like that. So the muscles get stiff, they get tight, you're not using your hips very well, and then you get up and you try to go be athletic, you try to go run, you try to go lift, and your hips just really aren't primed to do that. So if you can,
it's like you're stuck all day long sitting in a chair at desk. You're always stuck in the hip flexion position. So then when you go to do anything else, when you're standing up, when your hips are straight in that, like you explained, that neutral position, you may have issue.
Yeah, absolutely. It's a great way to, it's a perfect little summary there. And what we see a lot of times too is if you don't have the hip extension, you will get the extension from your back. So you will crank arch through your back as opposed to move through your hips, which tends to overload the spine, tends to stress the spine more than maybe is ideal, and can lead to some discomfort there as well. So I'm going to go back to the beginning here. So this video shows the couch stretch in different levels. So there's starting on an easier position and moving to a more difficult one. So this is a level 1 here. The other leg's not even really up yet. I'm supporting with the hands, and then the leg is up behind me. Level 2 is I bring the leg up, but I still keep the hands down. So this angle here, you can see the hip is really not even in extension yet. But what I'm doing is trying to stretch out the front of the hip here and squeeze my butt on this side to try to help get things activated, get things moving. As things loosen up, then we go into more intense versions of the stretch, we come more upright. So now there is more extension happening here, but still support. And then at the end is this last position I showed where I'm not supporting with my hands anymore. Now this hip actually is in extension here. There's an angle that's coming behind my body. Okay. So I always encourage people start at that level 1 position and then move up. If you feel like you're compromised, if you feel like your spine, you're cranking, arching through your back, or it's not comfortable, then it's not worth it. Stay where you are, work on it. If your hips are really stiff, it'll take a while. This position is hard to get
I was going to
into.
ask you, Zach. Yeah, I mean, I know it'll probably depend on the varying degree to the stiffness of the individual, but on average, if you can even say that, how difficult would it be for someone to get into that full position when they've never done it before, starting, of course, with the level 1, 2, and progress? Would that happen typically in one session or a number of sessions?
If there's a true hip stiffness going on, it'll be a number of sessions. This is
Okay.
kind of almost like a movement hygiene thing, meaning like if you were sitting for a really long time, if you were driving for a really long time, if you know your hips are stiff, throw in 30 seconds to a minute of this when you're literally sitting on the couch, right? Watching a football game, whatever it is, right? Just throw it out there, move around a little bit more. Little things like that can pay pretty big dividends for people. And that is why we have different levels of this, right? This is a challenging position to get into. But to go back to a more basic version of this, this is much simpler, right? The leg doesn't have to be as far up the wall. I'm supported. The other hip is not in as tough of a position. So it's a much easier position to get into. And there are always progressions, regressions of all of these things. So if anybody has questions and need other ideas, just reach out and even ask the question in the group. That's super helpful because then everybody can benefit from any answers and any videos we share and all that kind of stuff.
No, that's an awesome suggestion to ask in the group so other people can benefit from the answer.
Yeah, absolutely. Yeah. Cool. So we talked about low back, motor control, and then hip mobility, specifically hip extension. Those are the two like really good low hanging fruit stuff that's going to provide a lot of bang for your buck. And I want to get into some core training because obviously that's a big topic when we talk about low back pain. Okay. So there's a couple of things I want to share. One is a very basic exercise and one is a more challenging exercise. And then we'll talk about some other things that we can do to actually train the back directly. So we're going to talk first about what we would call an anti-extension exercise. So can we use the core to control the spine and prevent it from going into an arched position, prevent it from being dragged into an arched position? Okay. So this first video is called Dead Bug, and it's a really basic version with just a little heel tap here. What I'm doing here is flattening my back into the floor and then moving the feet. As that foot moves out, the back wants to arch a little bit. I'm using the core muscles to resist that movement. So the reason I put this one in here is because this is a way we really start to retrain this or get people moving if they have more acute levels of low back pain, meaning they're fresher injuries and it's kind of bothering them to do a lot more stuff. This gets them moving, gets them connected to their core again. And if you're new to core exercises or if these are just really hard, this is a great way to get started because it teaches you how to control your spine and your rib cage. So Jason, does that kind of like anti-extension concept make sense? Did I explain that all right?
Oh yeah, no, that's an awesome starter exercise for people with their core because again, a lot of people, like you said, have a weak core, and that contributes to lower back pain and just everyday things that you do, like the whole sitting for a long time and getting back up. This is just something awesome that I start off a lot of clients with that have a very weak core. Even just to test them out and see how they feel before going on to more progression, harder progression exercise for them. But yeah, no, that makes complete sense.
Cool. Yeah, and it's something that we find that if we start with this anti-extension position, it teaches people how to stabilize in other planes of motion also, and more functional things day to day, carrying groceries, carrying kids, whatever, because they've learned how to just kind of like brace a little bit. And just what you talked about in terms of more challenging versions of this specific exercise, what we'll have people do is extend their leg instead of keeping it bent, or extend both legs or extend their arms overhead too. And there's lots of ways to kind of progress it. So that's a kind of a basic version. And what I want to share is a much more challenging version of an anti-extension exercise that we call a hollow hold, that we use this a lot with CrossFit athletes, gymnasts, people who need to be able to stabilize in a more challenging position, hanging from a bar, doing handstands, things like that. But the concept still applies in that we are asking the spine to be controlled by keeping ribs down, core active and engaged. And what you'll see is just a few different levels of this movement. So this is a full hollow hold, arms overhead, legs overhead, and really that back is pushed into the floor. And then we're going to go into slightly easier versions where the arms come down, makes it a little bit easier. Then the knees come in and it makes it a little bit easier. And you can also do one leg at a time and that kind of stuff. But this is a really great exercise and it's really hard, which is why that video is only 20 seconds long.
I see now why, that first exercise, and I know we just talked about progressions and whatnot, but that first exercise, I think it really helps out to tell people about the mind-muscle connection. That mind-muscle connection. If you're not used to engaging your core or even your glutes, like in the previous exercise, to start off in those basic positions, really helps out with that mind-muscle connection as you're becoming a little bit more mobile, and then it just builds upon itself and you get better and better and you can get to something like this, which is, yeah, Absolutely. That does look, I give you kudos, man, because that's that exercise is no joke.
It's always a progression. It's always a continuum. We're training the same qualities, but we're on different parts, different levels of the spectrum, right? So, as you can see with this, that's why we talk about this. It's like a handstand or hanging from a bar kind of a position, because that's what we're doing here, right? And then we've got versions of this where we'll have people rock back and forth and do all this kind of stuff. So this is where I have fun. This is where I cook up stuff in the laboratory of my mind every night. And my patients will tell me, they're like, "What do you do? Like stay up late at night coming up with new ways to torture me?" And I'm like, no, you love this. It's great. It's fun.
If it doesn't kill you, make you stronger. That's what I tell them.
Right. I haven't killed anybody yet, so we're still here. So again, there are tons of core exercises, right? But if we're going to focus on one thing, anti-extension is a really good place to start. You can also, like a plank. A good plank is an anti-extension exercise. So when in doubt, do a plank, right? You can do a whole heck of a lot worse than doing that. I'd say I prefer that kind of stuff. When you were talking about back health, stability, and especially people who are in pain, I prefer that kind of stuff to start with as opposed to crunches and things where we're creating movement. Those are fine, but again, they're more challenging to do well than a lot of people realize. And I want people to learn to stabilize first, and then we create the movement. So that's what these things are doing.
Yeah, I think a lot of people get stuck on their core and strengthen their core. They get stuck on core flexion. It's more an isometric type of exercise that strengthens your core all the way around. Would you agree?
Yeah, I would, absolutely. And I think, like I said, there are the things we'll do, like, reverse crunches and things like that as well. But again, they're not the first things we do, because a lot of times when people come to us, they're dealing with irritation in the low back and the hips. So we want to make sure, all right, do you have good stability? Can you feel comfortable, safe, controlled, and with different forces acting on your spine? And then we say, okay, what's your goal, right? If your goal is to build an awesome six pack, or hopefully even an eight pack, right? Then yeah, you need to do direct core training, right? This kind of stuff is a great place to start. And a hollow hold on to that for 10, 20 seconds, and then tell me how your abs feel. Like, it burns. It's tough, right? This kind of stuff you can do. But then, crunches, sit-ups, hanging leg raises, all this kind of stuff is a huge part of a good program. But we like to start here first to make sure that people can build on top of a good foundation, as opposed to just say, like, all right, I want a six pack, I'm just going to crank out a bunch of crunches, and then wonder why their back is a little bit cranky.
Yeah, and it's a lot of the strength transfers over into exercises like, for stability, for core stability, like deadlifts, back squats, things like that as well. I think people don't realize when you're doing it, you're not flexing. It's like an isometric hold. You're just holding you're contracting your whole core to hold everything in place.
You got it. Absolutely. Yeah, that's great. And a couple of things I wanted to go over here too is that's more of our core training that people kind of traditionally think of. Other core training is just what you mentioned, direct work for the spine muscles, things like deadlifts, that kind of stuff. So I want to go over those quickly as well here. So
Excellent.
Another favorite of mine is just what we call a glute ham raise, right? So this is a specific piece
That
of
is a
equipment we have.
beautiful piece of equipment. I was going to say, not everybody has
Right.
that piece of equipment.
Right. We've got all the good stuff. We've got all the fun toys. So
Yes, you do.
there are lots of ways to do this without this piece of equipment, but it's a money when you can, because you can really target.
No
For example,
substitute.
no, right. Yeah. I mean, and just for example, we know, I think this makes sense to a lot of people, but if your back is stronger, you're less likely to have pain. And that's actually backed up by research. And we actually know, I use this as a test when people come in a lot of times, especially if they're a higher level athlete, is I put them into this position, into this like dead flat position right about here. And I say, hold it as long as you can. And if they can do it at least a minute or so, I know that their back strength is at least adequate to be able to, unless they're talking about doing like, 600-pound deadlifts, which I have worked with people who are doing 2, 3, 4 times body weight deadlifts, but that's another story. So this position, this is called a glute ham raise. So what we're doing here is we're actually asking the spine to extend a little bit, and the muscles that are called the paraspinals, which just means the ones that run up and down the sides of your spine. If anybody's ever seen those people, like, really big, strong people, powerlifters, strongman competitors, that kind of stuff, the muscles on either side of the spine, it looks like a rope right there. Those are the paraspinals. Those are the muscles that are help supporting your spine, amongst others, but specifically. So with this, what we're doing is we are coming over the pad, and then we're lifting up to about parallel, and that is training the spine directly. And there are lots of ways to do this, but I really like this because it teaches you how to, again, stabilize your spine effectively, and then and directly train it. And then also good old fashioned deadlift, right? Same kind of thing. Can I control the spine position and lift a weight off the floor? Doesn't get much more functional than that, right? Can you pick heavy crap up off the floor? Check. But it's a more challenging position than a lot of people realize. And a deadlift is one of those things that people think of as, oh, deadlifts are bad for your back. Like, well, no, deadlifts are bad for your back if you do them like a, what, right? You have to be smart about it. But if you do it well, if you load it up well, if you progress it correctly, if you get into good positions and train it well, arguably it's the best thing for your back, because it's strengthening your spine in a quote unquote functional position, right? If I can do this right here with body weight, 2 times body weight, something like that, when I go day to day to just kind of pick up my kid or get myself into a weird position, or I gotta move a couch or whatever, now I'm prepared for it. My spine is strong, my spine is capable, and I'm good to go. So just don't kind of dive into the deep end if you don't know what you're doing. Build some foundation, be smart about it, and then deadlifts are arguably the best thing you can do for your spine.
Yeah, it's so many benefits.
I'm a fan for sure. Well, cool. So those are, again, just some example videos right there, but just some illustrations of how to get your spine moving, how to get your hips moving, how to train your core, how to train your spine. And again, not a ton right there. You can spend 5 minutes a day doing some basic mobility work and then throw in a couple of exercises into your programs once or twice a week and it'll go a long way for you. So, the kind of last couple pieces of advice I want to share are sort of more around just general things you can do. And if you're in this group, hopefully you are interested in strength training. That's probably the number one thing that I recommend to people, whether you're in pain or not, to live a vital, healthy life now and well into the future. Strength train. Please make some time, strength train, put the time aside, work with a coach like Jason, work with somebody, make sure you are comfortable in the gym or doing some form of strength training, because it is going to pay massive dividends for you, both in terms of health, but just like how you feel and how you function day to day. If you did nothing else but strength train, walk, and eat good, you're
You're in good shape.
gonna be good, right? And it can literally be as simple as that. Like, eat real food, walk, and strength train 2-3 days a week. Like, you're gonna be 80-90% of the way there, seriously. So, you guys are taking good steps and being parts of groups like this, but please don't neglect that. You don't want it to be something where you get into your 70s, 80s, hopefully 90s, and you can't get out of a chair, you can't walk up and down the stairs, that kind of stuff. You build the strength you need for that kind of stuff right now. So, do it, ask questions if you need it, because we're here to help you make sure you're comfortable doing that.
Exactly. I mean, any issues that you have us for support in the group. Oh, I have lower back pain, and I hopefully you do try some of what Zach has shared with us, because like he said, just doing those simple things will make such a big difference. All you got to do is just do them. I know that we're busy people, right? But you got to make time for yourself too. If you want to be around later on, and you want to be functional later on too, as well.
Right.
You don't want to have to depend on others if you don't have to.
Right.
So I think
and we
that's
talk
the biggest
about,
thing.
like you said, simple doesn't mean easy, right? Simple, a lot of things that we need to do. And I think most of us, I always frame it this way. If you have a problem, if you're in pain, physical pain, whatever's going on, if you imagine your best friend came to you and asked you for advice for the exact same problem that you have, what would you tell them to do, right? The majority of the time, we actually know in large part what we need to do, at least in a basic sense. It's just the question is, do we actually do it, right? Like, so this is some basic stuff that are kind of across the board is going to be helpful. And then obviously, if you're dealing with more specific pain, that's what we're here for. So I just want to remind everybody, again, we're in Lakeville, help people like you all the time get out of back pain, shoulder pain, knee pain. We work with a lot of runners, people who just know that being active is a huge part of their life, and that their life is not full if they're not able to do the things they want to do from a physical standpoint. So I work with people all the time. So please let me know if you need our help with any of that kind of stuff. We're in the group. I'm going to be answering questions. Post those questions so everybody can benefit from them. And if you're having a problem, please ask the question so that you can deal with it now. Don't let it become a bigger problem. Don't say, oh, I'll deal with it after the holidays, because you may, but you probably won't. Oh, I'm going to set a New Year's resolution. Okay, fine. But start now instead of 2 months from now. And you're going to be better off,
Yeah,
sure.
you'd be glad you did. You want to enjoy the holidays pain free if you can,
Right.
or
Yeah, right.
going the other way. Let's start the year in a positive way, as opposed to going into pain.
Right. And so that the first time God forbid, when it snows, that you can be like, okay, I'm good. I can wrangle the snowblower. I can shovel my driveway. I've got this. Right. So, don't wait to go, oh crap, the first time you see the white stuff on the ground. So,
and how classic is this? We're talking about snow in Massachusetts in November, and it's 76.
Yeah, right. Absolutely. Sounds about right.
That's all right. It'll be 30 tomorrow. That's all right.
No, yeah, we'll be right back to normal. It's fine. It is pitch black and it's barely 6 o'clock, so that's about right.
So Zach, you're also you're opening up a group for runners locally in Lakeville.
Yeah, actually, we just started. So we're in the midst of a workshop series right now that we've been doing, and we have another one planned for Saturday. So I'll actually post in the group as well. We have what we're calling the Resilient Run Club. So for Southeastern Mass runners, we have a lot of runners that we work with, and they were saying, hey, there isn't a run club around here that we really like, or there isn't one at all. And we started one, and I think within 6 hours of opening, I had like 15, 20 people in it. We've got 30 something people in it now. And they're all good. We've got ultra marathoners, 5K specialists, other coaches, and people who've run forever. So I think it's going to be a really cool group, and we're looking to put together more workshops, more group runs, and things like that. So if you're a runner, even a little bit, right? Get into that group, soak up the knowledge, you know, share your knowledge, and I'll make sure I post a link to that as well. So a couple things. I will post, remember, you know, obviously you guys are on Facebook here, so remember to follow the Wagner PT and Performance on Facebook, Instagram as well. It's Wagner PTP, and you can just search Wagner PT and Performance on Instagram. That's where we share a lot of our tips, tricks, exercises, things like that. So be sure to follow there. And then I'll also post some resources from my YouTube channel that are, we have something called our low back pain survival guide, like, oh crap, I have some soreness, here's some things to try, virtual mobility classes, virtual mobility challenges, things like that, that we've put together in the past, not only for the low back, but for a few other areas as well. So I'll post all that, and I'll post some stuff to the Runners Club. And we've got a lot of cool stuff that we're doing. So hopefully we can, include everybody, and the more the merrier on all that.
No, I appreciate those resources. That's huge. I mean, so you guys have no excuses for lower back pain, with being able to try some stuff, or worrying about going to see a physical therapist right away. You can at least, toy with that a bit. But yeah, Zach, I appreciate you being on. You're gonna post that, and whatever you don't post or whatever, I'll post your Instagram stuff as well. I'll wait to see what you post first, but I'll post it again and again, because like I said, you have awesome content
I appreciate that,
on
yeah.
there. Very, very usable, very actionable content. And then you can find Zach at Wagner PT and Performance over at 290 Bedford Street in Lakeville, Massachusetts. All right. And again, if you have any questions whatsoever, please, ask right here in the group. That way everybody can benefit. And we will be doing another workshop, right, Zach, in about a month or so?
Yeah, so we'll do the same kind of thing. We'll poll, and the more engaged you guys are in the group, the better it's going to be, because I'll understand where the vibe is, what people are needing questions about, and that doesn't have to be specific kind of pain or specific joint. Like, we can cover anything, health and performance related. We've got runner stuff we can go through. We've got whatever. We've done breath work and mechanics type stuff. There's a lot that we can work on. So we can go over. We do dry needling. We can talk about what that is and what it can help with, and so the topics are functionally endless. So, engage, ask questions, reach out. We'd love to hear from you. And the more value we can make it for you guys, the better.
Yeah, that's awesome, Zach. Zach, like I said, nothing but the best for you guys. So make sure you make use of this resource. You guys have any questions after you're viewing this, go ahead and put them down in the comments section, or anywhere else in the group, and we'll see you the next time. Appreciate you guys watching the replay, and definitely appreciate you, Zach, and all the stuff that you've shared with us. And again, we'll see you the next time.
Thanks, everybody.
See you guys.